Hi everyone. I'm back with some more questions, and I'm sorry, but I think my camera carked it for the last few minutes of the exercise talk, and I'm really sorry about that. There were also a couple of late questions in about leg swelling and exercise. We don't really have any data yet in the setting of Fontan to know whether it improves leg swelling. It certainly does in the setting of other illnesses. I think it's important if you do have worsening leg swelling that you see your cardiologist and make sure there's nothing we can do to help improve your medications or anything else that also might be making your leg swelling worse. But anyway, for the rest of this little video, I'm going to be talking about Fontan and pregnancy and answering some of your questions about health and well-being. And if we've got time, we'll also cover a little bit of your questions about research. So first of all, somebody's asked, have you seen any more long-term effects on women going through childbirth to date? That is a very good question, and one that we've tried to address with a recent research project that has just been accepted. At the moment, we have no evidence to suggest that pregnancy impacts the Fontan circulation in the long term. Having said that, there's not a lot of data out there to guide us, but when we've looked at the women who have had pregnancies in Australia and matched them to other Fontan ladies who were similar to them in terms of heart function who did not have children, we haven't noticed any big differences. Okay, this is a really good question. If your daughter had a Fontan circulation, would you want her to have a baby? Yes, I would. Of course, I would want her to have a baby. Whether I thought she should carry a pregnancy herself would depend on a few things. First of all, it would depend on her heart function and her exercise capacity, and whether she'd had any really difficult to control heart rhythms lately. If she had good heart function and a reasonable exercise capacity, I would not discourage her from having a pregnancy or trying to have a pregnancy. If she did have the other problems I've mentioned, like a weakened heart or lots of abnormal heart rhythms, or didn't reach a good level of workload on an exercise test, I would explore other options for her to have babies. And the reason for that is that having a baby is wonderful, but if it's going to mean that it's going to make the mum sick, and it might make the mum so sick that she may not be around to watch her baby grow up, then I think we really need to reconsider. And that can be a really difficult decision. I have helped some of my patients explore surrogacy and adoption, which are other options. And just because you can't carry a pregnancy yourself doesn't mean that you can't be a parent in the long term. Next question. What do you say to your female Fontan patients who want to have a baby? Well, I think I've sort of covered that in the previous question. I hope I have. Do you differentiate with your advice between patients who have hypoplastic left heart syndrome and other underlying conditions when it comes to pregnancy? So for those of you who don't know, hypoplastic left heart syndrome is probably one of the most complicated heart conditions that can go down the Fontan pathway. And there is some evidence to suggest that those patients may have an increased risk of not doing well in the long term. If I have a young woman with a good Fontan circulation, even if she's a hypoplastic left heart patient who does not have trouble with heart rhythms and has a good exercise capacity, I think it would be very reasonable for her to try a pregnancy. The other consideration is, what are the oxygen saturations? Sometimes there's a procedure we can do to improve oxygen saturations before women get pregnant, because if the saturations are around 90% or lower, with normal being up near 100%, it can be very hard to grow a baby and increase the risk of miscarriage. It's not impossible, but it does make it harder. So sometimes if we can, we might do things to improve the oxygen saturations before the woman starts to try to become pregnant. Okay, so health and well-being questions. Do people with a Fontan circulation need to be especially mindful of hydration, and do they need to drink more water than other people? So it is important with a Fontan circulation not to get dehydrated, because it can mean that you get low blood pressure and are more predisposed to fainting. It does not mean you need to go around drinking a minimum of 2 litres of water a day or all that silly stuff that you hear about. It's just important that you don't let yourself get thirsty. And if it's a hot day, especially if you're doing more exercise, that you keep up your hydration. But drinking enormous amounts of water, even when you're not thirsty, is usually not necessary. Okay, next question. Is body mass index a good indicator of healthy weight for people living with a Fontan circulation? No is the answer to that. So I talked a little bit about this in the last little video about exercise. So body mass index is simply measuring based on your height and your weight on the scales. But in reality, our bodies are made up of bones, fat, muscle, as well as our organs. And fat takes up space, but it doesn't weigh very much, whereas muscle doesn't take up as much, it's much denser. So you can weigh quite normally on the scales, but have more fat and less muscle than you should. And what we're recognizing now is that sometimes we've underestimated people's fatness, or a more scientific word is adiposity, by simply putting them on the scales. And just because you are weighing up normally on the scales doesn't mean you don't need to exercise and work on having really healthy muscles and having a nutritious diet. That's very important for people living with a Fontan circulation. In terms of what is the best kind of diet, at the moment, we haven't got studies to guide us about specific diets for people with a Fontan circulation. But in general, I would recommend a healthy, well-balanced diet, just like the ones you see if you look at the Heart Foundation website, and making sure that you have a good amount of protein with most meals. And protein can be meats, but it can also be beans, and if you look it up on the internet, there's lots of information about that. And trying to avoid processed foods, things that are high in sugar, all the things that we would recommend. If you have a look, there's some really good information about diets on the Heart Foundation website. Okay. Do I need more or less sleep than most people because of my Fontan circulation? You just need the right amount of sleep for you. So everybody has slightly different sleep requirements, and we don't think that people with a Fontan circulation need particularly more sleep than anybody else, but everybody's a little bit different with their sleep requirements. Some people feel very good with 5 hours of sleep a night, and others need at least 8. All right, I feel as though coughs and colds hit me harder than most people. Am I more likely to fall ill because of my Fontan circulation? We do notice that people with a Fontan circulation do sometimes tend to pick things up a bit faster, or get knocked around a bit more than somebody with a 2 ventricle circulation. We do recommend that people have the flu vaccination once a year, and it is important that you know when it's time to head into the doctor for a checkup if you have picked up a really nasty cold. There's not a lot of evidence to support it, but sometimes I think that having low oxygen saturations can also predispose a little bit to picking up coughs and colds. And the other thing is, if you have a special type of problem where you were born without a spleen, that sometimes happen in people with a single ventricle circulation, that is a very special circulation situation, and you do need extra vaccinations if you live without a spleen. All right. Recently, I was told by our cardiologist that my son's liver reading was elevated. Why is that common in a Fontan circulation? And what is the eventual outcome if it continues to stiffen? Okay, so increasingly we've recognised that living with a Fontan circulation means that you live with a slightly stiffened liver. That's partly because the way we measure stiffness is with a little ultrasound probe, and the liver can be stiff if it's got scarring, but also if it's under slightly higher vein pressure. And everybody with a Fontan circulation has slightly high vein pressure, so that makes the readings already abnormal, even if there's not a lot of scarring in the liver. So the first thing I'd like to say is that we often see abnormalities in the liver, and usually the livers are working very well indeed. I generally like my people with a Fontan circulation to see a liver doctor who sees a lot of Fontan people, because sometimes it creates a little bit of alarm if a liver doctor hasn't seen this kind of thing before. The reason that we've started checking for this, particularly once you reach late teenage years and enter adulthood, is that a small number of people do start to develop important problems in the liver, and by watching that and screening for it, we can hopefully pick things up early and reduce the risk of things progressing. So we are screening all our adults usually once a year with an ultrasound and some blood tests these days. And if we're picking up more advanced levels of scarring, then we're doing the testing a bit more frequently. But most people with a Fontan circulation have slight abnormalities of the liver, and we really don't get too worried about it. All right. What do you see as the most common reasons for people or for adults with a Fontan circulation not keeping up with their appointments? For example, do some young adults stop taking medication or stop seeing their cardiologist just because they want to be like everyone else? It is a problem, not just in people with a Fontan circulation. It's an enormous problem in congenital heart disease as a whole, and people being lost to follow-up. And teenage years and early adulthood does seem to be an especially high-risk time. At the moment, we're actually contacting all the people who have been lost to follow-up, not just in the Fontan registry, but also at Royal Prince Alfred. And we're trying to understand why people get lost and what we can do better to improve our service. But research from overseas has suggested that there's several reasons why people get lost. Sometimes they think that they're well and they just don't need to be seen. I think sometimes people are frightened that we might pick something up. Yes, I think there's often a component in young people that they just want to be like everybody else. And they're probably the most common reasons. And we're working hard to make people feel safe and to engage them. And one of the important parts about transition is helping our young people to take some responsibility for their own health, which takes a long time, and it can take years until mum and dad can really take a proper step back. But it's important that they start to take a little bit of ownership by the time they're reaching their late teenage years and have a little bit of time on their own with the doctor. All right. How can parents best help their teen with a Fontan prepare for transition to adult care and take responsibility for their own health? Good questions. Some hospitals are now running transition programs. So there's formal clinics with a nurse who's a specialist in transition. And so the bigger children's hospitals are doing that now, and that's really helpful. But not all families have access to that. There's a lot of information on the internet if you're interested about helping transition processes. And remember, it's not just in Fontan that kids need to transition. It's in diabetes, cystic fibrosis, children who have survived early life cancers. There's a lot of different populations of children that need to transition across to adult care, and there's quite a bit of information out there. I think it's important that children, as they're reaching late teens, start to be encouraged to ask a few questions themselves or answer some questions themselves. And sometimes that won't come naturally and you don't want to force it. But as they become mature enough, it's good to let them answer some questions themselves. Encourage them to have an understanding about their heart condition. That doesn't need to be detailed double inlet, left ventricle, Glenn Shunt at 1982 but just understanding what's so special about a Fontan circulation and why it is, if they need an operation, that should be done at a hospital with doctors who understand their special circulation. Something you might have realised is that a lot of doctors really don't understand or know what a Fontan circulation is, and so it's important that you and your child learn to advocate for yourselves. Some other little things I think help with transition is once your child's old enough and mature enough, having a little bit of time by themselves with a doctor. It doesn't need to be the whole consultation, but sometimes we'll just spend 10 minutes without mum or dad in before or at the end of the consultation, which sometimes helps too. All right. With more adults now living with a Fontan circulation, what are the major challenges facing them and the medical community looking after them? Okay, well, I think one of the major challenges is making sure that we're providing the right services for you guys, because this population has really surpassed doctors' expectations, and we really expect the Fontan population to double within the next 20 years. So we're working really hard right now on making sure that we've got the right doctors, the right clinics, enough hospital beds, and we're also working really hard on research so that we know how to look after all of you as you're entering adulthood. And we've really made enormous headroads in that in the last few years through the Fontan registry and the research that's come out of that. And we're also working internationally as well. All right. Are all contraceptives safe for adolescent girls and women with a Fontan? No, not always. If you are not taking warfarin or one of the newer warfarins like apixaban or rivaroxaban, it's best that you or your daughter does not take the combined oral contraceptive pill, because it has estrogen in it, and estrogen can increase the risk of clots, particularly in the veins. So in general, and personally for most of my Fontan women, I try and avoid the combined oral contraceptive pill, but I do know that some of my colleagues who are excellent don't mind so much the combined oral contraceptive pill if the person is anticoagulated with warfarin. But for people not on those strong blood thinners who are only on aspirin, the combined oral contraceptive pill should definitely be avoided. There are some fantastic alternatives. So there's a little rod called Implanon that goes under the skin, and it's a very effective contraceptive, and most women's periods stop altogether. There are some women who get a breakthrough bleeding or feel bloated or don't really like the rod. And if that's the case, we also have an option called a Mirena, which is a tiny little pellet. It's really very small, and it goes inside the uterus. And it's a very effective and safe form of contraception. And it's really excellent for women who have heavy periods. It needs to be put in by a gynecologist. And we prefer, if you have a Fontan circulation, that it's done at hospital. But it's really a very minor procedure and does not need an anaesthetic or anything like that. So there are a number of really good contraceptive options. All right. Why would I be on an ACE inhibitor is the next question. So ACE inhibitors are a class of drugs that have a lot of evidence in the setting of traditional types of heart failure. So in the types of heart failure that older people get who have a usual type of circulation. And in the early days of Fontan, doctors used to universally put people on it because they thought, well, if it helps heart function in old people with heart failure, maybe it'll help Fontan. But there's been a number of studies since then in Fontan, and none of them have shown benefit. So most doctors looking after people with a Fontan these days only use it to control high blood pressure, or if you have weakened heart muscle function, or if you have a very leaking heart valve. So most of us aren't really using it outside of those settings. And in fact, we have a trial going at the moment monitoring people who we're stopping it in just to demonstrate to the medical community that it's safe, because there are still a number of people out there on ACE inhibitors with a Fontan circulation, even though there's no science to support that. And myself and the group of doctors I work with don't believe young people should be on medications unless there's a good reason for it. Okay, why would I be on a beta blocker? So the most common reason to use beta blockers in the setting of a Fontan circulation is to help control heart rhythm. And they're very, very effective medications in that regard. They are sometimes also used in people with a weakened heart muscle because, again, in traditional old person type of heart failure, beta blockers have been shown to be protective for heart function. So sometimes we might use it in the setting of a weakened heart muscle for somebody living with a Fontan circulation. Next question, why would I be on an anticoagulant? So there are some very strong reasons why you would be on an anticoagulant like warfarin with a Fontan circulation, and I'll list those for you. Number 1, if you've ever had a stroke or a clot. Number 2, if you've had atrial arrhythmias like atrial flutter or fibrillation. And number 3, if you have a very big, what we call a fenestration or quite low oxygen levels, that's another reason why oftentimes we would put you on a blood thinner to protect you from clot going the wrong way into your heart and causing a stroke. Now, in Australia, there are some hospitals that put all their people with a Fontan circulation on warfarin, whereas at other places, like in Sydney, for example, after the first 6 months or so of the Fontan, we just use aspirin, unless you have one of those very important reasons that I just mentioned. So there is quite a bit of practice variation in Australia. The medical evidence suggests that aspirin and warfarin are fairly equivalent in people who are low risk, so people who don't have those big problems I've talked to you about, like stroke, blood clot, abnormal heart rhythms. But if you're not exactly sure why you're on warfarin, it's definitely worthwhile going and talking to your cardiologist to clarify the reasons, because there can be some very important ones. But sometimes they might be open to a discussion about whether there are other alternatives. Okay, now next question. I'm concerned about drug and alcohol use and the impacts on the Fontan circulation. Do people with a Fontan need to take extra precautions? So I'm not sure, I assume you're talking about illicit drugs rather than pharmaceuticals. So yes, people with a Fontan do need to be a little bit more careful. So drugs like amphetamines that increase the heart rate and get your adrenaline running can trigger quite dangerous heart rhythms in anybody, and that can be even more of a risk in somebody with a Fontan circulation. And drugs like cocaine and amphetamines can also cause high blood pressure in the body and in the lungs, and that can be very dangerous. So those kind of drugs are best avoided. Smoking tobacco isn't a great idea for anybody because of the important impact on vascular function. And I would say anybody should be avoiding tobacco. When it comes to alcohol, my personal view is alcohol in moderation is okay. If you have more advanced liver scarring, then in that situation, the liver doctors generally recommend that you try and avoid alcohol or really minimize it because alcohol can damage the liver. And because we recognize that there can be some liver scarring in Fontan, some doctors get very cautious and really advise avoiding alcohol as much as you can. My personal practice is to just encourage people to be moderate. You don't want to go through life being having too many restrictions placed on you. I think it's important to be able to enjoy things and be a normal person as much as you can. Okay, what are the key things people with a Fontan should bear in mind, keep an eye on as they get older? Okay, so I think watching your weight is very important as you're getting older and really working hard to maintain a healthy muscle mass and keep your fat mass down. Keeping a healthy diet is really important. Regular exercise is absolutely essential for keeping your muscles healthy, not just the muscles in your legs and arms, but also your breathing muscles. So that the more exercise you do and doing it in a safe way, the better. And they'd be my main tips. And just making sure that you're linked up with a cardiologist who is a Fontan expert and that you're having a liver ultrasound once a year, a blood test once a year, and an exercise test from time to time. And sometimes we'd also be checking out the rhythm every few years or so, depending on what other problems you've had. Okay, as a general guideline, how often should an adult with a Fontan be seeing a cardiologist? So most of us would see our people living with a Fontan circulation once a year. I know some cardiologists only see their Fontan patients once every 2 years, but I think that's rarer. Most of us would like to see our Fontan people on average every 12 months. Sometimes if people have been a bit unwell or have some tricky problems, we might see them a bit more often than that. Fontan research questions. Okay, has there been any updates regarding liver involvement and possible treatments going forward? So there's been a lot of research characterizing what Fontan liver is and how we can best diagnose it. At the moment, we do not know how to treat it, and that's something that the community is working very hard on. And Eve Udichem has led a group of us, an international group, and we're working together very hard to try and come up with treatments. We think at the moment maintaining a healthy weight and being active is probably the best thing you can do to optimize your circulation. But hopefully within the next 2 to 3 years, we'll have a bit more information for you in that regard. Okay, next question. Are there any new questions you are seeking to explore in your research? So the main things that I'm working on at the moment are the impact of exercise on the Fontan circulation and nutrition. So we're planning a very big exercise project that you'll probably be hearing about in about a year in children and adults to understand the impact of exercise training over an extended period of time, over 12 months. We'll also be trying to understand what the impact is on the liver and on heart function and also on body composition. So how effective it is at building up muscle and losing fat. We're also trying to understand exactly what aspects of diet are useful for a Fontan circulation. And we're working hard to try and get a little bit more information about what type of body composition is better we're trying to understand, does it matter if you have a little bit of extra fat as a Fontan? So you will hear more about that at the Fontan Education Days and in our publications in the next couple of years. Okay, where can we find the research you have already published, and what are the key findings you recommend for individuals with Fontan keep in mind? So we often will put some of our publications on the Fontan Registry website. If you're interested in understanding a particular doctor's research, there's a little trick. If you go into Google and type Google Scholar, you will come into a really useful area of Google where it just has academic articles, and you can do an advanced search there and type in a doctor's name, and you can type Fontan in the title, and you'll get all their research that they've done, and you'll see the little, you can click on it and you'll see the abstract summary. It can be very confusing though. Some of that medical literature may as well be reading Chinese or another language, and I'd encourage you, if you're interested in something and you need it translated, to talk to your cardiologist about it, because sometimes it's very difficult, even if I'm reading medical literature in a field that I'm not all over, it can be very hard to put in perspective and sort of formulate what you're reading and make it meaningful. So, and sometimes what the research that you're reading just might not be very good research. So it is important that you go through it with a medical person to help you understand it. And the second part of that question was, what are the key findings you recommend for individuals with a Fontan circulation? So in the previous videos, we talked a lot about exercise. So to date, the most effective treatment for anybody living with a Fontan circulation to improve heart function and exercise capacity is exercise training. And we think that exercise is of heightened importance in the setting of a Fontan circulation, even more so than in other heart conditions, because it helps you maintain healthy muscles and helps blood be pushed back up to your heart. So exercise, exercise, exercise. All right, now, final question. What do you think will be the key focus for researchers with regards to the Fontan population in the future? So at the moment, we are, one, trying to do more research about exercise and make sure that our preliminary findings are correct, and also understand how we can help kids to start exercising young and maintain that throughout life, and how to change adults who have been relatively inactive to become active and stay active. And we're thinking of some really cool ways to train people, like a web interface like this, where you'll have your own personal trainer. So that's one thing. We're testing drugs to see whether there are any drugs that might help improve the hemodynamics and heart function in the setting of a Fontan circulation. We're also, there are a couple of devices under development to try and act as a little pump to help the Fontan circulation work better. So they're three of the big areas that we're working on at the moment. And I can assure you that there is a community across the world who are working extremely hard for you, the Fontan community, trying to improve outcomes and doing a lot of really great work together all across the world to make sure we're doing everything we can to help you guys live the best possible life you can. Anyway, that's all the questions. So if you have any further comments or questions that I didn't address properly, I'm sorry, but you're welcome to send me an email at Rachael, RACHAEL .Cordina, CORDINA @sydney.edu.au. See you later.